All right, well, let's talk about therapeutic ultrasound as it's related to performance in clinics and other healthcare settings. This will follow along the guide, page 398 of the guide, and I'm just going to zoom in a little bit here so we can talk more about this. Ultrasound, as you heard about before, and maybe you've seen last semester with Doppler ultrasound when doing the ankle brachial index, the ABI. It's a form of energy involving acoustics or sound energy and looking at how the energy emits from the transducer and it reflects into the tissue and it bounces back to create some type of reading or value. With that, there are a few terms to note with that. One of the terms that you'll need to know is about Hertz. Sometimes it's abbreviated HZ or HERTZ is how it also may be documented. But in terms of Hertz, it is the frequency at which these sound waves leave the transducer. So if I said something is 20 Hertz, that means that there would be 20 sound waves leaving per second. So Hertz is per second, cycles per second. CPS is sometimes another way this is described, but typically with Hertz. As we get into other modalities, whether it's laser, diathermy, E-stim, these are all measured in different cycles per second. E-stim in particular is often measured in pulses per second, PPS, instead of Hertz, but it's the same parameter. It's how many waveforms or electrical currents are emitted per second. And with that, there's a little bit of a range for this. So generally speaking, we tend to hear things within this 10 to 20 kilohertz range. So if you see kilohertz, kilo is 1,000. So we're talking 20 kilohertz would be 20,000 waveforms or cycles per second. And then if you look at something over 20,000, that's considered ultrasound. And a lot of people are aware of dog whistles or other animal whistles. They are at such a high-pitched frequency that we, with a human ear, cannot hear them. So when you think about a dog whistle, maybe 30 or 40,000 hertz per second, so it's inaudible to our ears, but dogs are able to hear things at this range. But when we're talking about therapeutic ultrasound here, we're talking a much, much higher range than even a dog whistle. We're talking something in this range. It could be around 1 million or 1 megahertz. Also, on the E-stim machines, actually, on the ultrasound machines, you're going to see that it often goes up to right around 3 megahertz, or sometimes it'll be labeled 3.3 megahertz, which would be 3,300,000 hertz per second. So it's a very, very high frequency that this is causing. And as something goes within the tissue and bounces back and forth at this high frequency, it's going to create vibration. And that vibration is a form of heat transfer. And if you think back to the different forms of heat transfer, this is a form of conversion. And it may cause heat and it may not cause heat depending on the intensity of these sound waves. So if you can imagine bigger sound waves or wider sound waves, that would be a higher intensity, even though the frequency is a different parameter. So the intensity will often determine whether or not there's going to be so much vibration of those tissues that it creates a thermal effect, which we're going to talk about down here, or a non-thermal effect, which would be just the vibration and some of the other mechanical effects that go with that. So as we look at the two main effects of ultrasound, you have your thermal effects, which is basically that of heat. Think about this like a hot pack, but we know that ultrasound can penetrate deeper, whereas a hot pack may go up to around 1 to 2 centimeters, 10 to 20 millimeters. Ultrasound is capable of going into the tissue at depths up to 5 centimeters. But of course, this is going to vary on the waveform in the frequency. So we're going to talk about this later, but it can go up to 5 centimeters or 50 millimeters. With that, if the intensity of the waveforms is at a significant level, it can cause significant vibration, and that will cause heat. It will cause these effects of extensibility of collagen fibers, just like a hot pack would. It would cause an increased metabolism and an increased blood flow. In terms of what is a decrease, it may decrease the muscle stiffness. It may decrease the amount of spasm or tension in the muscle, and it may also feel good. So it may decrease the pain. Not a significant amount, maybe from a 5 to a 4 or 5 to a 3. And part of that is the gate theory, where the patient feels the heat instead of other things as well. So even though there are these thermal effects, anytime ultrasound is applied, there's also these non-thermal mechanical effects as well. Now with this, you'll notice that there's a change in calcium ions flowing in. So there's just a change and an alteration in the normal metabolism and the normal process that cellular nutrients are perceived when this ultrasound wave, this sound wave, starts to disrupt the system, and often in a good way when I say disrupt. What is it going to increase? You may get more histamine increased there, so that may help with the healing process. You may get more phagocytic synthesis. You may get increased capillary density. You may get more fibroblast production and other things here. And along with the thermal effects, non-thermal also causes decreased pain. So that is a good thing. So those are some of the effects that ultrasound has been shown to have. So now when we talk about how do these mechanical effects occur, a big part of that is with sound waves and how sound waves cause vibration. When you first heard about ultrasound, you may have been thinking about in World War II, they had submarines and how they had sonar. And the way that that worked is that the ultrasound waves, or the sound waves, would travel through the water until they bounced off another dense object, another submarine, and the metal, it would bounce, the sound wave would bounce off and then come back to the original source. And that way they could determine how far another submarine or another object was from each other. And of course it would go off fish or other things, but if it would bounce off something dense and large like a submarine, they could basically identify the size and structure of that and the distance. So with ultrasound, instead of trying to wait for those waves to bounce back, with therapeutic ultrasound, we don't necessarily get readings of them coming back. You will with real-time and Doppler ultrasounds and other types of ultrasounds. But with the therapeutic ultrasound, we're trying to emit those waveforms into the tissue so that they cause these vibrations and cause this micromassage, these natural acoustic initiated deformations of the tissue. One of the terminologies that's associated with this that you should be familiar with is a cavitation. These are often associated with a popping or disruption of the bubbles, the nitrogen and oxygen bubbles that are naturally within our joint surfaces, and besides the joint surfaces, within blood, within fat, adipose tissue, within muscle, everything else. You may remember that a cavitation is sometimes described as when you crack your knuckle. That's one form of a cavitation. That's a rather large or significant cavitation with the sound audible that you hear with that. Ultrasound causes these small cavitations, because you have to remember ultrasound is delivered at 1 to 3 megahertz, or 1 to 3 million cycles per second. So it's a very fast speed. So in 1 minute, if it's at 1 megahertz, you're talking about 60 million sound waves penetrating that tissue in a minute. So that's quite significant. In terms of the different variations of cavitations, you have the stable and unstable cavitations. Unstable cavitations, pictured a little bit down here. So here you go. So you have your stable cavitation where you just get the vibration. Unstable implosion makes it seem kind of bad, but it's basically just saying that there's a disruption of that layer, and there's a change in temperature and pressure. So we're trying to get more of these stable cavitations, but if you keep the ultrasound transducer head on an area without moving that, you cause those vibrations to accumulate. And as those vibrations accumulate, it could cause the balloon, the bubble, to fill up basically, and then at one point that would rupture. This happens often if you are in a superficial area, especially at 3 megahertz ultrasound, and if you're around 1 to 1.5 watts per centimeter squared for the intensity, and if you leave it on that area for a certain period of time, you'll get these small unstable cavitations. They are at a very cellular level, so they're not going to damage the area significantly unless you keep the ultrasound on there for a prolonged period of time. So the way and why I mention this is to avoid the unstable, and how to get the stable cavitations is quite simple. If you move the transducer head and continue to move the transducer head, so if you keep the transducer head moving, you will avoid the unstable cavitations and you'll stay with the stable cavitations. So in terms of what are the indications for ultrasound, we're looking at anything where you want to increase healing. So right there. And so with that, is there some type of a pitting edema that you want to bring more blood flow and circulation to the area? Is there scar tissue, so chronic tissue, that you want to break up a little bit? Often it's combined with stretching, and that's shown to be helpful. Is there some type of chronic inflammation that would benefit from increased blood flow to the area? Bone healing, we're going to talk about how ultrasound can be used with stress fractures. And in particular, it seems to be most beneficial in the proliferative phase. And if you have to think about what is going on in the proliferative phase, why might that be important? So this is after the acute phase, or some people call this the subacute phase. One of the things that's quite prevalent in the proliferative phase is collagen, and how you have this building of collagen. And so that's quite critical in this proliferative phase. So we want to encourage that. So let's talk very importantly about some of the contraindications. With tumors or cancer, why would that be bad? Well, you can imagine that if you have a tumor which is defined by rapid growth, you're applying ultrasound to the area, which is going to provide a better environment for that growth, just like a hot pack would, but this is only more significant than a hot pack, and it could be a deeper penetration. So that would not make sense. We know that central nervous system tissue also would not be good to apply to that, because especially in more superficial central nervous system tissue that could be exposed. So maybe you're thinking in the spinal region, if someone had a laminectomy where the bone is no longer shielding the spinal cord, that could be compromised. And if you heat the area up, heat the nerve up, a neurovascular structure like that, it could cause changes in nerve conduction velocity, it could cause damage to the nerve, and other things along that line. Generally, we don't have to worry about that too much, because most of our CNS, as you can imagine from anatomy, is covered up by bone, and it's generally well protected, and it's not very superficial. So definitely when you're dealing with 3 megahertz ultrasound, which would be the more superficial ultrasound, you really don't have to worry about CNS tissue. So this is a very location-specific contraindication. Pacemakers, location-specific as well. We know that ultrasound does travel up to 5 centimeters. So generally speaking, over the left pectoral region, over the left shoulder, we would be concerned with that. We may even say over the left posterior shoulder, over the posterior infraspinatus or posterior structures, that would probably be contraindicated. You might be okay in the left upper trapezius, but to be safe, it's probably good to avoid that. But there's certainly no issue with ultrasounding the left elbow, the right shoulder, the right elbow, the right wrist, anything else along those lines. Even the cervical spine, if it was higher, would be fine. With that, we don't want to perform this over reproductive organs. That could definitely cause some damage or issues. Pregnancy, once again, this is a contraindication in terms of continued therapeutic ultrasound, but as you very well know, with pregnancy, ultrasound is routinely performed directly over the baby to determine the heart rate, growth, and so that is diagnostic ultrasound. It's not going to create a thermal effect. The parameters for that are slightly different, but ultimately with therapeutic ultrasound, we wouldn't want to perform that within 5 centimeters of where the uterus and the baby would be located. So if a pregnant woman had a right hip trochanteric bursitis and we want to do ultrasound to that area, that's certainly well over 5 centimeters from the area. So that would be okay, but you could see there might be some concerns with doing ultrasound to the lumbar spine or the hip flexors or other regions depending on where you're moving the transducer. In terms of joint cement or plastic components, because ultrasound can cause a thermal effect, if you take something like cement or basically joint glue or plastic, there is a chance that it could melt that tissue. So that really depends on the area that you're looking at. But in particular, this applies most specifically to thermal ultrasound. So with that in mind, you're not dealing with pulsed ultrasound as much for this one. As with anything, if there's a chance the patient has impaired sensation or mentation and that they don't understand ultrasound or can't tell you if it's hurting them, that would be a contraindication. And then lastly, thrombophlebitis or a DVT would be an issue because ultrasound could cause the effects of heat, which would include vasodilation. And if the area has vasodilation, it could cause that embolus or that clot to dislodge and travel elsewhere. There are also precautions you could see. So precautions, these are more your yellow lights that we want to be aware of, and then it's going to be very patient specific. If the area has acute inflammation, it's not going to make sense to do thermal ultrasound. So with that, instead what you're going to do is pulsed ultrasound. And this typically is going to be delivered either 20 or 50, not 505, 50%. Another thing you're looking at is overemphasis in growing bones. So we know that typically this tends to be around 15.5 for females and around 17.5 for males, but those are just some general ranges. Ultimately, the best way to know if there's a growing epiphyse or not is via radiograph or x-ray and determine is the growth plate closed or open. And if it's closed, then we know that it's safe to do ultrasound. So that may factor into, let's say you're doing ultrasound around the knee where there's could be a growth plate, but if you're doing ultrasound to the hamstring or the quadriceps, you're pretty safe knowing that it's not going to reach into the joint because it's less than, so it's greater than 5 centimeters. So not worried about that. Breast implants would be another contraindication. But besides breast implants, any kind of silicone or other tissue implants. I know some people have calf implants, and they're getting other things implanted into their body. And so with that, the heating and the thermal effect, and if you take the closed container and you heat that tissue up, that silicone or that fluid up, it could cause expansion. That could be a problem. And then over fractures, this is definitely a precaution because you'll see later one of the indications for low intensity pulsed ultrasound or LIPUS, LIPUS, is going to be fractures. That is what a bone stimulator is. So with that, one of the reasons we're doing that, LIPUS, is indicated for fractures. So another thing that'll be important to be aware of is the concept of attenuation, and this certainly factors into laser, diathermy, and ultrasound. And attenuation is saying that absorption or that loss of energy with the sound waves, with the diathermy, with the laser, as different tissues receive that. You can imagine what will happen with sound. So if you've ever been in an auditorium or a sound with acoustic soundproofing, you'll notice that a lot of those things are meant to absorb the sound, so the sound doesn't travel as far. And you could think if you put sheet metal up on certain walls, what would that do to sound? Well, that would cause the sound to bounce off there more, and it would actually increase the sound because you'd get the reflection of the sound. So some tissues cause more reflection of the sound, and some tissues cause more absorption of the sound. And a lot of this has to do with the structures. Are they joints? Are they bone? So bone would be much more like a very dense metal. So it's going to reflect off of bones, whereas with other tissues, it's going to be absorbed more. Collagen is one that absorbs it, and there's some other listings here of what absorbs versus what retracts off bone. So in 401, here's a great summary of what happens with ultrasound and diathermy. You notice here, one thing I want to point out, so when ultrasound is applied, so this will be at the level of the skin right here. As it's applied, it's going to go through the adipose tissue, through the fat. It's going to have relatively low attenuation. It's going to travel nicely through fat because there's a good water content there. And then you'll see it's starting to get higher attenuation, so it's starting to get absorbed more. And then what do you see here? You have a bone. Once it hits the bone, do you see how it has a little increase? So what happens is it bounces off the bone, and this little spike is from when it bounces back from the bone, and now it causes an increase in attenuation into the area, that later decreases, and then it would be lower on the way back. Versus microwaves, which is a form of diathermy, those aren't used as much. Capacitive plates, which is another form of diathermy, and you can see how this is absorbed greatly in adipose tissue, not as well absorbed in muscle and then in bone. So this may factor into your patient type. So if you have a patient with a large amount of adipose tissue, ultrasound would be quite better because it would have less attenuation through there, as opposed to diathermy, which would have a high amount of attenuation with adipose. And this may also factor into the body region you're dealing with. So let's say you're doing this for someone's shoulder. We know shoulders generally aren't going to have a high amount of adipose tissue, but if you're dealing with someone's hip and you have to go posterior through the glutes, we know there's a large amount of adipose tissue there. So that may factor into your decision-making process. But this is just a good summary to have here. Ultrasound is really good to target collagen tissue, which we mentioned before is peaked in that proliferative phase. And then you can see some absorption and penetration levels here. So you can see with sound, and this is for 1 megahertz ultrasound, sound waves traveling through water are going to penetrate really well through water, sonar and ultrasound. For this reason, when you're using that, you're using ultrasound with a coupling medium. So on the transducer, there's that ultrasound gel, which is water-based gel, and that helps that ultrasound to go from the transducer to the patient's skin. If you wouldn't have the gel in there, the ultrasound waves would basically dissipate into the air, and hardly anything would ever get absorbed into the skin and other tissues. So water is a great low attenuation structure that allows for a lot of penetration of those sound waves. You can see nerves though, and this would be why it's contraindicated. One of the reasons in CNS in particular is that there's a great absorption in nerves. This is peripheral nerve. This would be very similar to absorption for central nervous system. So with that, we want to be concerned with using that over nervous system structures. So as we get into the nuts and bolts of what a transducer looks like, you'll see basically there's this coaxial cable, which is providing the electricity to the ultrasound. The electricity is coming through here. It's going to resonate here. There's a crystal. These have changed over the years. They used to be a natural quartz, but now they're a synthetic composite material that has shown to have a better waveform refraction. It's going to come out here. This is a term we'll talk about later. The ERA, that's an important term to know about the effective radiating area of those sound waves from there. We do want to clean the surface with 70% alcohol to prevent any cross-contamination of anything that may be on patient's skin, such as bacteria, Staphylococcus aureus, or other things like that on there. But with this, let's look at the next topic, which is the piezoelectric effect. This is important. This sometimes comes up on board questions. And the concept here is pictured pretty nicely. So if you take a rock or a quartz or some type of crystal, metal, if you take a hammer to it, so you're applying a mechanical stimulation to that area, mechanical compression, it's going to cause an electrical volt. That is what's known as the direct piezoelectric effect. By applying a stimulus, it's going to create electricity. For this reason, this is why bone healing, it's important to have vibrations and weight bearing at certain stages with proper bone healing to get the piezoelectric effect. Ultrasound uses what's known as the reverse piezoelectric effect. So now, instead of causing a mechanical vibration, which would create energy and sound, we're adding electricity to the rock, to the metal. That's what the ultrasound machine is doing as it sends the electricity through the cable, through the transducer, into the quartz substitute into there. And that's going to cause, that electricity is going to cause a mechanical deformation. So it's going to cause that quartz, synthetic quartz, that crystal, synthetic crystal, to vibrate. And those vibrations are going to create sound. And that's what's known as the reverse piezoelectric effect. Here's a good visualization for the ERA, the effective radiating area. This is going to be specified on each transducer. On the cord of the transducer, it is directly related to the crystal size, and that's something the manufacturer is going to determine. And that crystal size is not always the same size you would think it would be. Sometimes you have a very big face of the transducer but a small crystal, or sometimes you have a medium-sized transducer face but a very large crystal in it. So that's why it's going to be important to look at the transducer cord to see what it's set up with there. And here's just some representations which may or may not be drawn to scale. But what is important is, pretty much every textbook will say this, we want to do ultrasound for 5 to 10 minutes per 2 times the ERA. So if the ERA is 4 centimeters, 4 square centimeters, we want to apply ultrasound to an 8 square centimeter area on the patient for 5 to 10 minutes. So that's something that's very good to know right there. Another factor about ultrasound, and this has to do with the quality of the quartz, is the BNR, or the beam non-uniformity ratio. As this crystal vibrates, it doesn't create an even distribution of the sound waves. Over the middle portion, basically, of that crystal, it's going to produce the most intense sound waves, and other portions are going to be limited. So we look at what is the average, the spatial average intensity, as opposed to the peak intensity. And when we look at the peak intensity compared to the average intensity, that's going to give us the BNR. There is generally a recommendation of not to go above a 6:1, because if you go higher on the BNR, typically it's going to create more chance for a hot spot or burning the patient, because they're getting burned by this peak intensity as opposed to more controlled or smoother intensity. So that's something to watch out for. Another way to prevent that burn would be to keep the transducer moving, like I said before. And a general recommendation is to go about 4 centimeters per second. But Weaver, in a study here, found that if you go slow or fast, as long as you keep it moving, you're going to produce the same temperature elevations. And different clinicians have different preferences. Do they want to go in circles? Do they want to go in letter S? Do they want to go clockwise, counterclockwise, up, down, left, right? It really is a preference. The key thing is to keep the transducer moving. That is the most important thing about ultrasound application to prevent burns, especially of the periosteum, which is the area that tends to receive that burn. Keep the transducer moving. As we talk about 2 of the different settings on ultrasound, we're going to talk about 3 megahertz. Sometimes machines have that 3.3 megahertz, which is 3 million hertz per second, versus a different 1 megahertz. This has to do with the waveform length. And if you're producing a higher amount of waves per second, the wave length is naturally going to be shorter. Whereas if you're producing fewer ultrasound waves per second, the wavelength can be longer. So the important thing here, this is very critical to know, is that 3 megahertz and 1 megahertz are going to have different depths of penetration. There is the duty factor, which is pulsed or continuous. Pulsed means it's on and it's off. It's on, it's off. And this doesn't happen for 1 or 2 or 3 seconds. This happens within the second. So different machines are going to change this, but it's not going to be noticeable to you that the sound is on and off. And we'll do a little demonstration of this in lab. But the frequency determines depth. And the pulsed or continuous often determines whether or not you're dealing with thermal, which is for continuous, or if you're dealing with non-thermal primarily, which is for pulsed. So pulsed, as you can imagine, would be better for acute conditions. Continuous would be better for that proliferative phase or the chronic stages. Other parameters to know about would definitely have to do with the intensity. The intensity is going to determine the rate of heating. The higher the intensity, the more vibration of molecules, the more thermal effects that occur. This is measured in watts. And as you turn the knob up on the ultrasound machine, you'll see that it's calculated into watts per centimeter squared, at least in the United States. That's a common way. In Europe and other countries, sometimes they measure this in joules, and they don't calculate it this way, but it's very standard in the United States to have watts per centimeter squared. If you are going for the goal of thermal effects, you want to go, very important, you want to go to the patient's perception of a gentle warmth, and ultimately it's important to test sensation before to make sure they can sense what a gentle warmth is, but this will determine if you're in that thermal range or not. You will notice that if you're at 1 megahertz, to get that thermal effect, it's going to take a higher intensity. Versus 3 megahertz, it's going to take a lower intensity. That's because at 3 megahertz, you're emitting 3 times the amount of sound waves. So 0.5 watts per centimeter squared at 3 megahertz would basically be equivalent to 1.5 watts per centimeter squared at 1 megahertz, because 1 megahertz is 1/3 of the waveforms as 3 megahertz. So with 3 megahertz, which is going to be more superficial, you're going to go for a lower intensity. 1 megahertz, you're going to go deeper for higher intensity. Treatment length is going to vary, and the technique is going to vary, and we'll practice these things in lab. Here is the calculation for the duty cycle, and you can see here this is measured in milliseconds, which would be 1/1000th of a second, or in this case 2 1,000ths of a second, or 8 1,000ths of a second. And so review this formula in this example of a 20% duty cycle and a 50% duty cycle. And then along with this, there's LIPUS, low intensity pulsed ultrasound. This is essentially a bone stimulator. So if the bone's not healing appropriately, one of the thoughts is by adding more vibrations, more stimulus, at a low level, it'll simulate what a weight bearing would do. Although weight bearing might be too aggressive, so in order to bridge that gap and to build up to weight bearing, you may have a bone stimulator applied for 20-30 minutes a day, could be several hours a day depending on the physician recommendations, but this is a prescribed medical device. And then this is also another good algorithm or table to look at, looking at, are you dealing with soft tissue shortening? Are you dealing with delayed tissue healing? Do you want to go with more thermal or non-thermal, 20 versus 100%? So 100% is listed here, but that's known as continuous, and 20% is listed as pulsed. Different machines will have different amounts for pulsed, but 20 and 50% are the standards. Sometimes you'll see an 80% or 75%, and then these things line up there. So this is a good little chart to know. This is another representation of how 3 megahertz is 3 times the intensity of 1 megahertz. So it's not going to get as deep, but it's going to be more intense and create a significantly higher tissue temperature rise, TTR, as opposed to 1 megahertz. And then going through the coupling mediums, gel is the most common. There is this water immersion technique where you put the hand underwater. One of the issues with that is a lot of the waves can be absorbed and go different directions in the water, so sometimes you have to increase the intensity for that. Here it looks like almost a hockey puck. It's gel, and if you're dealing with irregular shape sizes like with the MCPs, the knuckles, things like that, you may see some clinics have this, but I think it's still pretty rare. One of the important things as you look at the transducer head, and that is to make sure that it's parallel to the surface you're applying there. And if it's not, it's going to go in different directions. So to have that at an angle, you're going to lose a lot of that acoustic energy. So you want to apply that parallel to the surface. So looking at attenuation and thinking about what does this mean to you? What is different about bone as opposed to these other tissues? And some example of the immersion technique, realizing that you might have to increase the intensity if you're doing this. But the other thing they mention here, which is true, if you want the patient to feel a gentle warmth and you put them in hot water, how do you distinguish between them feeling the hot water as the gentle warmth or the ultrasound as creating the gentle warmth? So you might need to just be aware of that. So that is a little bit of an introduction to ultrasound. Keep digging into this and writing and thinking of questions. There's another video coming up that will go a little bit more in depth into parameters as it relates to different cases and clinical applications. And then in lab, we'll do a little bit more with this. Hope that was helpful if you are new to ultrasound. And please write down any questions and we can discuss that later. Thank you.